World needs urgent transformation of mental health care. The World Health Organization has called for urgently transforming the global mental health and mental health care. As nearly 1 billion people were living with a mental disorder in 2019 before the COVID-19 pandemic struck. Mental health illnesses have risen significantly since then. Depression and anxiety went up by more than 25% in 2020 alone, the first year of the pandemic. Mental health conditions include schizophrenia, autism spectrum, eating and bipolar disorders, anxiety and depression. The Geneva-based organization issued its largest report on world mental health since the beginning of the 21st century. WHO said the report provided a blueprint for governments, academics, health professionals, civil society and others. With an ambition to support the world in transforming mental health and mental health care. It said, for decades mental health has been one of the most overlooked areas of public health, receiving a tiny part of the attention and resources it needs and deserves. It urged mental health decision-makers and advocates to step up commitment and action to change attitudes, actions and approaches to mental health, its determinants and mental health care. The report said mental disorders are the leading cause of disability. And the nearly 1 billion people with mental disorders included 14% of the world's adolescents. It said suicide accounted for more than 1 in 100 deaths and 58% of suicides occurred before age 50. It said people with severe mental health conditions die on average 10 to 20 years earlier than the general population. Mostly due to preventable physical diseases. Childhood sexual abuse and bullying victimization are major causes of depression. Social and economic inequalities, public health emergencies, war, and the climate crisis are among the global, structural threats to mental health. Stigma, discrimination and human rights violations against people with mental health conditions are widespread in communities and care systems everywhere. 20 countries still criminalize attempted suicide. The report urged all countries to accelerate their implementation of the Comprehensive Mental Health Action Plan 2013 to 2030, which was signed by all 194 WHO member states. The plan committed the members to global targets for transforming mental health. WHO Director General Dr. Tedros Adhanom Ghebreyesus said, "Everyone's life touches someone with a mental health condition. Good mental health translates to good physical health, and this new report makes a compelling case for change." The inextricable links between mental health and public health, human rights and socioeconomic development mean that transforming policy and practice in mental health can deliver real, substantive benefits for individuals, communities and countries everywhere. Investment into mental health is an investment into a better life and future for all.
With the latest news on the United Nations and the world, make sure to subscribe to this Facebook account by clicking the button above this video. See you next time.